Okay, we're going to get started. It's 3 o'clock. Okay, so we'll start this by giving you all the in code. That number is 38. Okay, so we want to welcome everybody to the final session for today, and this is about the Behavioral Health 1915cHCBS waiver feedback session. So I forgot I've got to advance the slide, so let me try and do two at once. Wanted to bring up a quick agenda for you all so you can get an idea of how we've got this organized. Because it is a feedback session, we are providing an opportunity toward the end to provide feedback. We will also pause to offer an opportunity for you to ask any questions. But we're going to first start out just talking about introductions, housekeeping, what is the purpose, and the purpose in the session objectives. Behavioral, we're also going to talk about the Behavioral Health 1915cHCBS waivers in Michigan. We're going to start off talking about the waiver renewal. What is the renewal timelines? What's the renewal process and requirements? And then this is where we provide an opportunity for feedback. And we've sort of organized this in a manner that we think will be helpful to you all in terms of thinking about the waiver renewal, what's impacted with the waiver renewal. So we've separated that by services, by waiver processes, by waiver requirements, and then other. And at the very end, we do include in the slides links to all of our waivers. So remember, the C waivers are the habilitation supports waiver, the children's waiver, and the serious emotional disturbance. And then at the end, we'll have another opportunity for questions, and we'll provide the conclusion. So first off, I want to introduce my co-presenters and myself. So we have Rayanne Galarno. She is our Habilitation Supports Waiver Specialist in Federal Compliance at MDHHS. And then we have Amanda Lopez. She is the manager of, and I always forget her section, Home and Community-Based Services Policy and Implementation section. So she's in the Children's Bureau, which, if many of you are familiar with, that was created a little over a year ago. I think was when we had the reorganization. And my name is Lindia Duramity. I am the manager of the Federal Compliance section. Much easier than Amanda's section name. So just some quick housekeeping items. You guys probably are already aware of this, just to make sure your cell phones are on silent. We will pause again throughout the presentation to take questions. We've also allocated time at the end to provide your feedback. So you can provide your feedback with potential suggestions for waiver changes. We've also provided, I laugh about this because I put 5x7. I actually think they're 3x5 cards. So I don't know what I was thinking. I think maybe I was thinking you all have like plenty of feedback, so I'll get you big enough cards. But we do have some 3x5 cards. We're going old school here, where you can, if you don't have an opportunity to provide your feedback out loud, you can write it down, or if you're just kind of one of those shy people, or if you just have so many, you don't want to ask all the questions out loud, you can write them down. We'll collect them at the end. And again, one of the other things we want to mention is this is our first waiver feedback session. So CMS has asked us to provide feedback sessions so that we can get input from our PIHPs, our CMHSPs, families, individuals served, and our community partners. So this is one of many that we plan to schedule this summer. So we will also have opportunities. I think there's two other trainings. We have one with the ARC that we're doing, and then we have another one in, I think it's the Wraparound Conference. And then again, we'll have others scheduled. And many of you, I see lots of familiar faces who participate in any of our leads meetings. You'll have opportunity to give feedback then. So we are going to go ahead and get started unless anybody has any questions about what I just went over. I think you're all pretty smart and don't have any, but if you do, I don't think it was complicated. So I'm going to hand it over to Amanda.
All right, good afternoon, everyone. So we are going to go ahead and get started. I know Lindia covered just a little bit of this, but the 1915C 1915C waivers includes 3 different waivers that we're going to cover today. One is the HAB supports waiver, one is the children's waiver program, and the other one is the serious emotional disturbance waiver, SED waiver. They do expire September 30th, 2024. So yes, we are already getting started thinking about gathering feedback, trying to get organized for the changes that we know others want to see, changes that are needed for the waivers. It takes a long time to get it all put together, and Lindia will be going over the timeline so you can get a sense of what that process is like. It does take a while to get the waiver renewal applications around for CMS. So we want to start the process now. So this is the first opportunity to provide feedback, will not be the last, and hopefully it will get the questions out there to start thinking about, so future opportunities you can all provide feedback to.
Change?
Yes, go ahead. Okay, so objectives for today. The first one is to gain knowledge about current behavioral health waivers in Michigan. So there's a brief slide I'll be covering on each of the waivers that covers eligibility criteria as well as the service array. So the services that are currently covered that were approved in the 2019 waiver application with CMS. The next one is an opportunity to provide feedback and suggestions regarding the services, the processes, and the requirements of the waivers. So it's not just the services, it's everything from how does a family learn about the waivers, how are they determined eligible, what does that process feel like to families, to staff working with the waivers, is there improvements that could be made to make it more efficient and make it smoother. So there's a lot of pieces that go into the waivers that we're hoping to get feedback on. And the last one is to learn about the That's okay. Behavioral health waiver renewal process. So as I said, we'll be covering the timeline, just so you know the pieces that go into the point that we're finally turning in that waiver renewal application. Okay, you can go ahead. All right, so we're going to get started with the HAB support waiver. So just a general overview of the HSW. The eligibility requirements include that the participant is a person of any age with an intellectual or developmental disability, is living in the community, in a community-based setting, not in a hospital, an intermediate care facility for individuals with intellectual or developmental disabilities, nursing facility, correctional facility, or child caring institution. And they are, while receiving HSW services, they have current Medicaid eligibility and would otherwise require the level of care services provided in ICF, if not for the availability and provision of the HSW services in the community. The HSW participant must require and receive at least one HSW habilitative service per month. And the maximum waiver participants on the HSW is 7,902. And I won't read all of those, but on the right-hand side, you'll see all of the services that are currently covered under the HAB support waiver. Yep, go ahead. Okay, so the next one is the Children's Waiver Program. So again, just a general overview for the CWP. The purpose of this waiver is to provide community-based services to children under age 18, who, if not for the availability and provisions of the services covered here, would otherwise require the level of care and services provided in an ICF. The goal of the CWP is to enable kids with developmental disabilities who have significant needs and who meet the CWP eligibility requirements to live with their parents or legal guardians and fully participate in their communities. So the objective is to provide regular Medicaid state plan services and waiver services to address the child's identified needs. And the maximum number of CWP slots is 569.
Oops, sorry.
That's okay. All right, and the last one is the SED waiver, so the waiver for serious emotional disturbance. So the SED waiver provides services that are additions to Medicaid state plan services for children with SED who are enrolled up to the child's 21st birthday. The waiver permits the state to provide an array of community-based services to allow them who would otherwise require hospitalization in a state psychiatric hospital for children here in Michigan, it's Hawthorne Center, to remain in their home and community. And the maximum waiver participants for the SED waiver is 969. So we want to pause there before we go into the timeline. Any questions about the general overview and services on those 3 waivers?
How did you come up with those numbers? I know, how random.
The number of waiver slots? Do you want this?
Yeah. So each waiver, there is a different, I don't know if this is the right terminology, methodology in terms of making that determination. So if you think about the habilitation supports waiver, the HSW waiver, that was created when we started to close our intermediate care facilities. And so that was really based on the number of individuals we had in those facilities and what that number would be in moving those people out to the community. So with this waiver, or this waiver renewal, we are going to look at those numbers again for the habilitation supports waiver. It doesn't mean we're gonna go up in numbers of waiver slots, if that makes any sense, because that does require legislative approval, because that will require an increase in funding. But what we will be doing is looking at the Medicaid members for each of the regions, each of the 10 regions, and then based on that, there is a methodology to determine how many slots, HSW slots, we should have available for that waiver. The children's waiver, the children's waiver and the SED waiver, we just increased those numbers at the last waiver renewal. And I'm trying to remember I think that was based on the need and the demand for those waiver slots. Again, there really hasn't been any discussion about changing those numbers, because if you ever have time, and we'll direct you to the links of the waivers, those were graduated up. So like, I think last year we went up to, maybe it was the year before for the SED waiver, that went up to that max number. And the children's waiver, that increased by 100 slots, I believe it might have been 2 years ago. So there is methodology that is used behind that. We use our actuary provider to help us calculate what those costs would be. We also look at data and demographics in terms of, individuals with disabilities, individuals with Medicaid in the regions, because with the children's waiver, it's not just based on kiddos with Medicaid, because as you all understand, that there is their waived income or their parents' income is waived so the child can qualify for Medicaid. So that one doesn't necessarily base it on children that are on Medicaid, but instead of children who have disability, who have an IDD diagnosis. I don't know if I answered your question. It was a great question. But again, we're gonna show you a link to all of the waivers. If you want a lot of, just a good time reading this summer, it'll probably take you the whole summer to go through each of the waivers, but it does give a better understanding of how those numbers are determined. Okay, so, sorry, thank you. So I'm going to go over the renewal timeline. I think Amanda did a good job of sort of describing that there is a lot involved with this. This is a very broad summary of the renewal. This could have been probably 10 or 12 slides if we really incorporated everything that's involved with the renewal. But we just wanted to do a really sort of broad perspective to give you all an idea of what that entails. I first just want to kind of briefly go over the waiver quality report. So that is a report that we're required to complete to CMS. This was the first year I think we had to do this. So that was due in December of 2022. And that really focused on our performance measures that we use for all of the waivers and our sample methodology. And so we had to report to CMS that information summarized for the last 3 years. At the time, we didn't have FY22 data. We were actually gathering that because part of the performance measures that we report on are included with our 372 report, which is also a required report to CMS. So this was really a summary. The waiver quality report was a summary for CMS of all of our 372 reports. And this is really what they're basing, what they want to look at is they want to look at, A, do we have good performance measures? Are our performance measures really measuring quality of service? Are they really monitoring the services that people are receiving through the waiver? The second thing they want to look at is our sample methodology. Are we sampling adequate numbers of individuals on our waivers? And is it enough to really inform our quality of service, or if we're providing quality services? So CMS just got back with us. I actually think they sent their response back to us on 4/28. So we have to respond to their response, which you'll see on 7/28/23. And basically, to summarize their response, they wanted us to provide FY22 data, which we will. In addition to that, they questioned a lot of our sample methodology. I should note that CMS has all new staff. So, much like all of us facing a staffing crisis, they are also facing a staffing crisis. So they have a lot of new staff that, from my understanding, have not been there in the past, so they may not be familiar with Michigan. I think it's also important to note that Michigan is very unique compared to any of the other states. If you happen to look at any of the, again, summer reading, if you wanted to go to the CMS webpage and review some of the other C waivers or other 1915 waivers that other states have, you will find it's very different. I mean, even if you go to Ohio, our neighbor to the south, they are set up completely different than we are. So it's hard to really compare us to other states, but I think in some ways, this is just my opinion, don't take this to CMS, or I think we're kind of a little bit maybe a thorn in their side in some ways because we are so different. But that's my own opinion. That's not for anybody to, not that it's bad, but I think we're so different that it's difficult for us to compare to other states. But I think us being unique is great. I think it really is what makes the services in Michigan wonderful, but it also sometimes makes it difficult for our reporting and to make sure that we're meeting those measures. So in the middle, well, actually the third bullet, I have May through September, the waiver renewal feedback sessions. So this is the first session. So we welcome feedback from this session in terms of ways that we can change it, but this is really just an opportunity for us to get feedback from our stakeholders, PIHPs, just what can we change? Is there anything we can do better with these waivers? And so this is, again, the first of many. So I touch base on the report back to CMS. So the final report due to the state, so once we complete our report, CMS does the review, they are gonna tell us at this point from CMS's perspective what we have to change in our waivers. So that's not, there's no flexibility in that. If CMS says you need to do A, B, C, and D, we have to do A, B, C, and D. So I think that's important to keep in mind because there might be some components of the waivers that maybe you all have feedback like, please don't do that again. Like, why do we have to have research every year? CMS might say, no, you have to have it. So that's why they would be there. So the dates between 9/30/23 and 4/3/24, that's why I said this is very broad. There's lots of internal work that's going to happen at that time. So we have already started our process looking at our waivers, looking at some things that we know that we need to change. And then we'll take the feedback that we get from these sessions, we'll implement it in there, and we will start to work on our waiver application. So the other things that are gonna happen in that internal work is that if we do add a service or we do remove a service, we have to collect data on that. We have to have our actuary team look at that. We have to see how that will impact costs. If you add a service to a waiver, so let's say we were to keep the HAB waiver as it is and we decided to add a service, we have to have our actuary take a look at that to make sure that we will still fall within, basically that our costs for community-based services will be less than institutional level of care. So with the HAB waiver, when we submit our application to CMS, we have to put down our estimated costs for the next 5 years. We also have to put what is the estimated cost for institutional level of care. We don't have an institution in Michigan. We have no way of being able to provide that from our state, so we have to get that data from another state. And I can't remember who we got it from. I don't know, Rayanne, if you know.
I feel like Ohio.
Ohio? Okay. So we end up getting that data from CMS. CMS provides that for us from other states' data, and we use that. So when people think about adding services or to any of the waivers, there has to be consideration for cost. So if we were to add 20 new services to the HAB waiver, it's likely going to cost more for this community-based waiver than it would for institutional level of care. So we always have to keep that in mind. Our waivers would never get approved from CMS if something like that were to occur. And so based on that, CMS will send us a letter, or CMS will send us a letter and say, hey, you have to do this waiver renewal. It's just a basic alert to us, like this is what you need to have done, this is the due date. Then we have to have the renewal application to CMS on 7/2/24. That's important because the other thing I need to point out is in between that time, we still have to do public comment. That's minimum 30 days, 45 days for tribal. In addition to that, we have to summarize our public comment. We have to go back and forth with CMS sometimes at that time, or back and forth with our public comment. So we need to make sure that we provide ourselves enough time to do that. And then we have to submit that to CMS on 7/2/24. There could be some back and forth with that, but our waiver does expire on 9/30/24. So you'll hear us say dates like the 2019 was when our waiver was renewed. Well, it was renewed on 10/1/19, but many of you are aware fiscal years start in October, so it's technically started FY24. This one will therefore start FY25. I really kind of hit a lot on this, so I don't know if I really need to go over it again. Yeah, I think I hit everything. But I do believe we have an opportunity for questions. Anybody? Yes. Oh, hold on. She's bringing the mic. Cheryl's bringing the mic to you.
This is me being very during this renewal cycle, are you expecting anything to come from the CMHs?
Yep. Well, yes.
I guess. What do I expect that you're going to need from me?
Feedback. I mean, we need to know. I mean, you're all boots on the ground. You know, you're the individuals that provide the services. You know the day to day. So we need that feedback. I mean, I believe our like, you know, I oversee with Rayanne the HSW. So we do get good feedback from our leads, but I think it's even more important to get feedback from that more broader audience. And you know, from the CMH perspective, you are all out visiting families, you're providing the service, so it's even that great connection to those families to say, hey, the MDHHS is asking for feedback, here are, you know, waiver session feedbacks, you know, to provide it to families, but also really just give us your honest opinion. I mean, we're not gonna go, bad idea, and, you know, throw your card away. We need to hear those things. We may not be able to take in every, you know, request or every, you know, suggestion for change, but sometimes that can inform us maybe where we can go in a different direction, or is there something we're doing right now that we could slightly change that might make things easier? Like, you know, and we'll get to it, but like one thing I think of immediately is like credentialing and those credentialing requirements. Are there some services where we are asking for, you know, education, experience that's way above what's needed? See? Yeah, so it's something like, you know, it's those ideas like that. And Rayanne's gonna go through and kind of provide an opportunity for you all to think about those things. But again, we wanna hear from you.
Thank you.
You're welcome.
You mentioned that in a HAB waiver is based on the institutional cost in Ohio. Could you even give us an idea what that annual cost might be?
You know that? Oh, I thought, I was like, oh, from the other group okay. Who is really intimidating? And what? I don't know if we have anybody that could go over there.
I can.
Okay,
I can get
Cheryl's gonna
somebody.
go over there.
Oh, okay, no, I don't mind, I'm already with you.
Are you sure?
My son goes, I don't like it when you use your Marine Corps voice.
Honestly, I would have to look but we'll go through. In fact, when we get to the links, I'll show you exactly where that's at. So it's public information and everybody will be able to see it. But it breaks down that information in terms of the cost for community-based services and then the cost for institutional level of care. But we're guessing at where we got it from, which state. Belinda would probably know because she knows a historical perspective, but we'll probably use the same state unless perhaps they close down institutions. Again, we do get this information from CMS, so, but I don't think it's on the waiver. I don't think that's identified on the waiver. But if you're okay with waiting till the end when we click on that, we'll show you that information. Okay, so I'm gonna hand it over to Rayanne.
Thank you. Okay, so we're now at the point where we're looking for your feedback. On the next 4 slides, we've broken out different sections to kind of categorize the different areas of feedback for the waiver renewals. So we invite you to provide feedback following each section, or you can provide your feedback on the index cards that were provided. So the first section is around waiver services that are provided through each of the waivers. Things we'd like you to think about include if there are additional services. Oh, are we on the? Did we go too far?
There we go.
Okay. So if there are additional services that should be included in the waivers, do we have services in the waivers which are underutilized or not beneficial? Do we have any ideas to improve current services which are in the waivers? Are there any services that are available in one waiver that should be available in another waiver? And for certain services, can provider requirements be changed? And I'll just pause to see if anybody has any feedback they want to provide. Yeah.
I'm coming.
I'm back and I made it happen. Thank you.
Thank you.
I'm very, very sweet. Just ask the guy to turn it down, the soundboard guy. So I have a question. I work in adult IDD case management. I'm a social work supervisor. What are our largest concern about the children's waiver coming onto the HAB waiver, because it's an automatic walk-on, right, is that parents are dumbfounded by what they lose because of one day in their child's life. Because the mom looked at me and said, "What are you talking about? I had 96 hours of respite yesterday. Nothing has changed." And I said, "Ma'am, what has changed is your coverage. Your insurance coverage has changed." And so there needs to be a different way to inform parents, because they're not being informed, or we need a better marketing plan, because on the adverse of that, when I'm trying to talk to parents about, I think it would be beneficial if we get you on a waiver, they want to know exactly what is the benefit to me. And I always market the overnight health and safety, right? Like, eventually you might need that, or the out-of-home non-voc for, someone in a specialized res. But those are the things, and so I've asked our county about, could we just find a better way to market it to families as to why it's beneficial? Because we have adult children now that their parents don't remember an institution. They don't even understand what that language is. What is ICF? What is CLF? What is AIS? What is that stuff? They don't even know. And I always tell them they're lucky that they don't know. You are blessed because you do not know. But anyway, it's just that. Parents of 18-year-olds are traumatized when we tell them they get $3,000 a year, which is their maximum, instead of 96 hours a month of respite. And they are beside themselves because the transition is poor.
Thank you. I think that's really great feedback.
And we're jotting all of this down because we are going to collect all of the feedback throughout all the waiver sessions in addition to other avenues that we're getting feedback, just so you know.
I just wanted to add to what Millie was saying, because overnight health and safety services was great when it was added to the HAB waiver, and then a couple months later, you guys issued a bulletin and it was added to CLS, which is great, except for I had people lining up to be on the HAB waiver to get it, and now I don't. So people don't see the differences with the HAB waiver compared to the ISPA services. There's hardly any differences.
I was just gonna say something similar. If I can be on the I and get CLS, what's the benefit to move to the HAB waiver? And that's a really hard conversation. In addition to services that maybe, I still struggle with goods and services on the HAB waiver side. I don't know if anybody's been able to crack that one very well. The way the service description is, it kind of limits how you can maybe try to use it. So that would be one that I would give feedback on. I don't know that it's really value added the way it is in the Medicaid manual, but I don't know how you would kind of revamp it to make it more value added.
So that is on our radar. Yeah. I will say that's on our radar. So we are looking at that. So Shannon, right? Any feedback that you all have or suggestions, we want to hear. We want to hear if it's a matter of, and again, I keep referencing back to those links, but goods and services is very well defined in the HAB waiver, the HAB waiver application. And so if there's anything that you, in terms of any suggestions you have changed, I think it's that replace a human service. So it is on our radar. That is one of the things we have internally that we are looking at. So, but again, good feedback, and please still provide the feedback too, because I think that will also, we might have something internally that we're looking at, but hearing it from, again, boots on the ground, families, individuals served is even more helpful because it just brings a little bit more power into making those changes and the need for the change.
Yeah, I was just going to add to that too, that I think a big problem, or I don't want to say problem, but just something that I've experienced. I used to be a supports coordinator. I still work in the same field. My role has changed a bit though. I think when I was working on these renewal packets and talking to guardians of individuals receiving the waiver, it was really hard to answer how, kind of bouncing off of what Millie was saying and Annette, it's really hard to determine like what that benefit is for your individual, because as a supports coordinator, I myself, and I did do a lot of enhanced pharmacy work. That was a lot of what, in the overnight health and safety element of it, but I still felt like at the end of it, I didn't really understand. So I was reading, it's like, well, this is your benefit here, but I was reading exactly from the paper because I really didn't understand what that meant either. So I wonder if each benefit that is listed could maybe have in the future something that breaks it down, and how does that apply to me or my future if something changes in my needs and I have an increase in need where this would apply, because that does make people feel like there's not much of a difference in having it versus not, and that's not what we want either, especially if they would benefit from it. So
also, as far as services, kids moving from child waiver to like HAB waiver, losing things like music therapy, massage therapy, the families don't understand that as well. So I don't know if that's common or if that's my misunderstanding that music therapy doesn't go beyond child waiver, but adults enjoy music just as much as kids. And so the families have really struggled with that. And then also regarding the child waiver, sometimes allowing certain services to overlap, such as maybe the CLS provider being able to sit in with the music therapist and do that as well, because sometimes it is an issue with family not having the time to do that, but also wanting that service and trying to juggle between, do we have CLS or do we, you know, maybe not go to work so I can do music therapy with my kid? So just something to kind of think about, you know, being able, like, what services should be able to overlap to provide the support for that child during the time that they could be getting a habilitative service.
Horse therapy is another one. Yep. The horse therapy is a huge loss to parents mostly, because it helps so much with their children who have cerebral palsy. It naturally releases those tendons and muscles and such. So we have a lot of people mourning the loss of those services that she mentioned, and also the horse therapy and any other, it's overnight, and they're traumatized. And I really think that our kids system needs to do better at explaining a transition, or maybe there could be a fade out plan, so that here, you're not gonna get 96 hours every month, but you can still have 48 for the next year. So that there's a fade out plan instead of, oh, that was fun, be well.
Yep.
I want to kind of from the case coordination perspective, so we do a lot of education, my team, and my case holders have children, they have adults, and so we work really heavily on transition planning, and we currently haven't had any children's waivers in a while. But because we do so much education, and I don't let them use this excuse, but there is a big difference in HABS waiver requirements that we submit to the state database than we do for the iSpa. For example, you guys get to see all of our individual plans of service, and many times we will get a kickback on, you have to make changes. And staff know the difference between, we only have to put the dates of the plan of service in the iSpa, so it still could get picked for an audit and get picked apart as well. So I don't pay attention to what ones I'm reviewing, so they're all held to the same standard. But I will say that that is a contention point for my case holders. It's something that comes up frequently of, okay, if we're gonna be expected to do things the same way for everything, then it should be the same expectation of what has to be submitted, so that everybody's held to the same standard, because they know it is a point of contention. I look at every individual plan of service as if it's a HABS waiver and going to be submitted for review. But there are other CMHs that don't do that, because I'm sorry, the honest truth is, we know in an audit we're going to find things we haven't done well, or that we've done inappropriately or incorrectly, or just things that we did in our interpretation was different. So I think that's something to be said for, the database should be acquiring the same data across the board, because I do think that my case holders will make a good fight about why someone shouldn't be HABS, and at the end of the day, I will look at every one of them and say, is this because you don't want your plan submitted? Because I know what I asked you to do to the plan, so did you do it? Or are we gonna look at it and it's not done properly? So I do think there's something to be said for, when you are educating your case holders, and you do have a small CMH where they do take all sorts of different cases in my DD team, like I don't have enough children just to have a children's team. So I do think that's important as far as feedback, to understand that sometimes I think that there are people out there that are like, I don't want y'all looking at my plan and telling me I did something wrong, and now I gotta do double the work, so I'm just gonna put them in the iSpa.
Or they don't wanna do the extra paperwork that's required for the HAB.
Yeah, we were aware of that, and I appreciate the honesty. I truly do. We've gotten a lot of feedback with the 1915I, and I know that that's not really where we're headed in this. But I think that feedback is valuable, because we're hearing it. I mean, you guys have all been very great about telling us these roadblocks that you're facing because of the requirements. We are looking, it's at the very, 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 very beginning stages of looking at whether we can do like a direct EMR connection between EMRs and the waiver support application, and really starting with the 1915I. I don't know what that will look like. I don't even know if it's possible. I mean, again, we're having internal discussions right now to see if it's even an option, because we're thinking about the administrative burden that's being placed on everybody. And I know when, with the 1915I, this is what I'll say, if you recall, I talked a little bit about if CMS says we have to do this, we have to do this. That's what happened with the 1915I SPA. If we could have kept it under the B3W waiver services, we would have kept it that way. But CMS said, absolutely not. You can no longer do this, and it has to be an ISPA service. And when you have an ISPA service, then you have that requirement for the department to have that final review, just like any of our waiver renewals. I mean, I don't, worst case scenario, and I think we designed the 1915I knowing the magnitude of individuals that are provided that service, not to have it have the heavy requirements of the HAB waiver. And that's sort of why we designed it that way, to leave the onus of collecting those documents and having those documents on the PIHP and the CMHSP. I don't think that we can move the HAB waiver toward the I, but we could move the I toward the HAB waiver, which we don't want to do. So, but I appreciate this feedback, and I know it's true. I mean, I appreciate people being forthcoming about it. I don't know what the solution is, but we're looking at it. We're looking at it.
Hi. So I don't know about that stuff, but I do work at a correctional facility, and the rehabilitation that we provide for the inmates, I'm finding that if they don't max out, they're given that opportunity to have waivers for housing and things of that nature. If they're paroled, they get that. They get the CMH, they get the MDHHS, but if they max out, they don't have that option. They're not being given any opportunity to have resources. So is there something that's being implemented for them within those waivers so that they can have access to that? Or has that been considered at all? Because people that max out typically have done 30 years or 25-year sentence. They don't have any knowledge or education nor the developmental process to access things when they do get out. So that's my question. What are we going to do for those people?
So we don't oversee the 1115 waiver, but I think that's where where some of what you're talking about would fall in line. What I'll say about the 1115 waivers, it's actually up for renewal the same time as ours, but that's a much bigger, that's large. That's a large waiver. I believe the plan was maybe, and again, don't hold me to this, but I think they were gonna ask for an extension from CMS just so that we could be able to wrap our arms around that and look at that. But there will be an opportunity when that waiver gets renewed, and I think that's where that information would be. But we've got this down to see if there's anything we can do. Also, I don't know if they would so our waivers are community-based waivers for the C, so individuals who are incarcerated or in jail would not qualify for that. However, that's where I was thinking maybe the 1115, there might be something under there. So appreciate this feedback, because it's stuff that, again, we typically don't hear. So very, very, very valuable.
So I had a question around the WSA. Would there be any consideration to moving the HAB it doesn't exist. Never mind. I was thinking in my head I was like, with the 3-year certification under autism, like if we could, because it's an intellectual and developmental disability. No? Okay, I tried.
Yeah, CMS says annual.
Annual? Yeah. I didn't know if that might be some feedback they might be open to.
Yeah.
So we're trying to move everything to this MyCal, right? Can we just scrap the WSA, which every time you go in there is bad, and just move it to MyCal? Since we don't use MyCal like we're supposed to anyway, can we just move it all to MyCal?
No.
Oh, okay.
Sorry, I just didn't say no. Sorry. I have to be direct on that one. Maybe in the future.
I have feedback about overnight health and safety, and I know a couple folks already mentioned it. So we know that it got added for SCD and for children's waivers, but when we read through the details, there's an exclusion about cannot occur in a family home, and the essence of those waivers is that the individuals are living at home with their families. So it makes it really hard for any of the youth in either of these programs to access this service.
Thank you. I wasn't aware of that. We'll have to look that up. So you're just saying it's on the children's and the SED, but not in, because that's not ringing a bell for HSW.
I can send it to you. I was just looking. It makes it hard to ever use overnight health and safety for youth in either one of those waiver programs.
Is that in the Medicaid provider manual or in the application?
I'm not sure. I'll look it up. I mean, I was just looking. I'm not sure which document it was in, but it was surprising. So I'll look it up and send it to you.
Okay. All right. Thank you.
Okay, any other, I'm glad we have such a interactive audience. This is wonderful. All right, so I think we'll move on. All right, so the second section is related to the waiver process, which includes the enrollment and recertification processes and the waiver support application, or the work completed in the WSA. So we're looking for your input really around improving the process for enrollments and recertifications. If there are changes in the WSA that could be made to increase efficiencies, and any other ideas to improve efficiencies with the waiver process.
Sure, I'm not shy. So the legal form, the legal recertification form that we have to, the HABS waiver, legal we have families that we've figured out how to digitally send it to them, but then they send it back to us not in legal form, and then we get in trouble because it's got to be in legal form. And everything's digital now. So the problem is if somehow somebody changes the parameter on it when you send it to them, yeah, and then the guardian gets mad at me because they're like, what do you mean I got to re-sign this thing? I've already signed it, I've already sent it to you, I'm on vacation. I'm like, oh, well, okay, you can't change the parameters. And then, if you have someone who's not really good on the computer like I'm not, they'll say, I don't even know how I changed the parameter, so what am I supposed to do? And then we've gotten lucky, we've been able to figure it out. But is there a reason why that's such, I mean, it really is difficult, to be honest. And I'm a parent of a HABS waiver person too. So when they tell me to do it digital, I'm like, no. If you want that in legal format, you need to either tell me, I'll come get it, come drive it to my office, but please don't send it to me digitally because I will screw it up every time.
Related to our legal department when we revamped our form for ADA compliance.
So I don't want to tell you my name because I don't want you to kill me. So recently I started working the WSA a lot more, and the WSA for me at best is clunky. It's difficult to navigate, very difficult to navigate. So even just as me in the data quality department trying to make sure things are done correctly, or to make sure things are done so that way we can send out waiver surveys, and it's, like I said, if we can change it to MyCal, which I know you said no already. But I mean, yeah, it's very hard to navigate, I would say.
You're a fan of MyCal, though, so I like that.
Well, I'm not a fan, but I guess it's better than
The better of the two.
Right.
Hi, I've been using the WSA for years, and my question is on the review, because obviously there's so many different components when you're putting in the PMLA information, you're uploading the IPOS, and you're also having a section for the habilitative objectives. And so I am somebody who goes overboard. I'm putting in all the detail, it's repetitive, and I think it's kind of subjective. on how much detail needs to be here. And I think some guidance on that would be helpful. If I could create efficiencies, like maybe I don't need to write this 3 different times. I don't need to say, here's their rehabilitative objective with toileting in 3 different spots. So I think some guidance on that. It can be quite repetitive, and not knowing who's reviewing it or what they're reviewing. Sometimes we get stuff sent back, sometimes we don't. That's just kind of my 2 cents.
I'm curious if that was specific to any waiver specifically, or is it HSW?
It's definitely the HAB.
Okay, thank you.
Yeah, you're welcome. I'm sorry, I should have specified that. I've
Nope,
done work with
just wanted to
CWP
make sure.
too.
I know they're a little bit different, so I just wanted to make sure.
Well, some good news is that, just real quickly, with maybe some of the changes with the WSA, it might not require a anything in our waiver renewal application. So it might be things that we can just work on throughout the year. So feedback like that is always good and welcome at any time. So if you're finding things to be repetitive, and if there's a way to create efficiencies, always let us know.
Absolutely. I don't think anybody else had their hand up, so I think we're okay to move on. All right, so our next section is related to the requirements for documentation, our performance measures, initial enrollment, recertifications, oversight, staffing, and training. We would like you to kind of think about and consider ideas to reduce paperwork requirements, any suggestions related to reducing staff qualification and training requirements, suggestions to increase efficiency for oversight of the waivers, and are there any requirements that you feel like are unnecessary?
I am coming.
So I am a case manager, and I write these goals, I write these objectives, and I write these interventions. And sometimes what you guys are asking us to write is a novel. And if our person-centered plans or IPOSs are supposed to be written in consumer-friendly language, these plans are not consumer-friendly language. They don't understand it. Their staff does not understand it. And it's just very difficult to try to even explain to a family member why something has to be written this way. So if there's training, or if there's a way to make it a little simpler, because I'm always a keep it simple, stupid kind of person, I think that is something that would be really beneficial and helpful. And I think the other thing too is, like, in thinking about person-centered plans, you know, some of our plans, you know, because they are more self-directed, have, like, I don't know, 5, 6, 7 goals with A through G objective. And the one thing that, like, I try to explain is, like, those are a lot of goals. And if we really only need one, right, for HAB, but really they should all be measurable and obtainable. So we got to try to streamline it in any way.
I would say from a staff qualification standpoint, the repetitive of like the CMHP, QIDP, QMHP, that is something that can be very subjective and is difficult in credentialing, you know, especially on top of the licensures that people are already required to have. That is, I find, difficult, and I'm only having to, you know, prove those during our waiver audits compared to other reviews. And from a rural county standpoint, some of those requirements when it comes to the massage, art, and music therapy on top of the credentials that those individuals already possess, that can be really difficult for us to find. providers to do that. Like we have a CWP that's paying out of pocket for massage therapy because this individual is choosing not to go and do another board certification on top of her multiple board certifications. So that's difficult.
Great feedback.
Kind of adding to that with the qualification piece, we went through the staffing shortage too, and with supports coordinators having to be QIDP to work with somebody on a HAB waiver, if there was a way to have the oversight sign off, like I'm a supervisor, so I am a QIDP, can I sign off on that instead of making that supports coordinator be a QIDP, because they have to have the experience to get that.
Sorry, my leg is hurting, but if I make faces, it's not at you. Yes, you can sign off on that.
Is there a spot in the WSA?
I think this. Here, let me give it to Rayanne, because.
Yeah, in that QIDP section, wherever that's required, that's where you'd be signing. Yep. Very good.
Sorry.
All right, so our last section is on any other areas we may not have included in previous slides. Oh, we're good. Okay. Right. So the things we'd like you to kind of think about are their ideas on how to improve the quality of waiver services, suggestions on how to increase the number of individuals who are enrolled on each waiver, and lastly, are there changes that should be considered with policy language?
Hi, is the state considering making any changes to the wraparound training for facilitators, just considering the changes that the SED waiver has kind of brought into the forefront?
What kind of changes are you thinking of for the wraparound training?
Well, when I think about traditional wraparound, facilitators really have really minimum pressure. They're really focusing on the family. When it comes to the waiver, we put in a lot of more strict timelines. They're not trying to develop free PCPs and wraparound plans at the same time. And to be honest, some of it isn't covered in the regular wraparound training.
Okay.
It's skills that you kind of have to pick up as you start doing the waiver, and I think it might be helpful to kind of add just some additions to the training so they're aware of that going into it.
Sure, yeah. Thank you for the feedback.
In regards to the number of individuals on the waiver, this is specific again to HAB waiver. That's mostly where I'm at. Our region has utilized all of our slots for, I would say, the last few years for the most part. And we were given additional slots. And I want to say that's been very helpful as a region because there was underutilization in other regions from what I understand. And so I just want to say I appreciate that. And potentially if we could continue that, that would be really helpful.
I think we're going to see with the waiver renewal, when we look at those numbers, that Medicaid member in regions, I think that is going to change some of the allocated slots to each of those regions. And we have had several regions come forward to us and say, give us more slots, give us more slots. And we've had some regions say, we're struggling to fill our slots, we'll give you slots. So we know it needs to be redetermined. We just have to make sure that we are in the percentage that we're required to. So for example, if let's say one of our larger regions, their percentage of Medicaid members didn't change, it would be difficult for us to justify reducing that. Hopefully that won't happen. Hopefully with the new data and looking at this information, it will be true to, we'll truly see where these slots need to go. But thank you. That is something definitely we're looking at because we're seeing an underutilization. I think what's happening with those regions that are able to maintain those slots, doing fantastic, staying up at that, above that 95%, but we have several regions who are just struggling to fill these slots. And so that's one of our main things on our waiver renewal that we need to do and look at that slot, because we have to report that to CMS. We have a measure to meet, and we haven't been meeting it. I don't know for how many years. So CMS is probably going to ask us as well, like, you better look at this and figure this out, because you can't have your utilization so low. The one thing I will say that we didn't mention is that, you know, for the last 3 years, we've been in a public health emergency, and we've certainly recognized that in terms of how our performance measures are, because you know, we are not performing well as a state. We really aren't. And so now that the public health emergency has ended, you know, we're hoping that, and again, we're not going to see it at this next, you know, when we look at our next cycle of audits, because that's going to be monitoring for FY23, not FY24. So it's really going to be interesting to see what our data looks like when we're, you know, technically out of the public health emergency. What does that look like, and how's that changed? But thank you. That's really great feedback.
Hi, I'm a parent, but just thinking about to increase the number of individuals served on the waivers, I never heard of the habilitation waiver, and my son was in the CMH services for 3 years, and then finally I heard another group of parents talking about it, and they're like, you should be on the HAB waiver. I go, what's a HAB waiver? And so some of it could be people aren't told about it, and then they don't even know to ask for it. Asked my sports coordinator, oh yeah, Sam would be a good candidate for that. Well, why didn't you tell me before? So some of this to me has to do with the education of and the requirements of the sports coordinators and them knowing what they're supposed to be suggesting to consumers. And I don't know if it was because they're worried about the slots filling up too fast, or I don't think it was even done intentionally, but it's just, why wasn't I told about a habilitation waiver and what it was right off the bat? So
That's really great. Great for us to hear this.
Yeah, I actually agree with that, because I'm a caseworker and I actually signed up for this to learn about the waivers. Because I don't think that unless we're writing the goals or we're completely participating in that, we don't know what they are or how to let the parents know what they are. So deeper training for us as caseworkers would be great.
So just real quickly, I want to add, you know, through the pandemic, we were not able to have the waiver training, and that for those who've been around for a while, I see Teresa, right? Teresa nodding her head. Probably one of the best trainings for our case managers and supports coordinators. We are having it again. So we'll have an in-person one in November. It's November 14th and 15th. Yep, it will be here at the Kellogg Center. We have some excellent trainings. We're already preparing for it. We're actually solidifying our trainings right now for it. So get the word out. I think that would be an excellent training for you and your coworkers. And here's what I'll say. I started off as a case manager too, and you know, in this position, especially when we were rolling out the 1915I, I was working with the 1915I specialists, and the whole idea of this service is under this waiver, and then this service is under the 1915I, and I don't need to enroll them in the WSA because they're receiving this and this under this waiver. And I remember saying to Monica, is her name, like, holy cow, if I were a case manager right now, I would be like, what the heck are they talking about? Like, I have no clue, like, because you don't think about funding. You don't think about waivers. You just are there doing your job, you know, making sure the person has what they need, making sure you meet all your criteria. You're writing your notes, you're doing your plans of service, you're doing all those things. So Monica's created a really great sort of cheat sheet that has like a list of services that are provided under each waiver, and we will be going over all of that stuff. So I just wanted to plug that conference with this group of people. So in November, and it's Simham is also sponsoring that, so we're pretty excited about it, but I think you'd really find it beneficial. Yep. Yep. Yeah, I don't think we've it's not been, like save the date hasn't been done yet, but I think it will be soon. I don't think Cheryl might. No, yes, okay. Yep. Yeah, just keep an eye, yep. November 14th and 15th. So for people who hunt, might not be a great time for you. Right, so I apologize for that, if you are hunters, right? Okay. Pardon me? So I think Simham usually sends out save the date, and it would be on their webpage. Okay, so this is the fun time. Oh, somebody had a question, sorry.
Yeah. Just one more comment, and I'm not sure where this piece comes from. Actually, so I primarily work with adults. So the rates for the children's waiver versus the adults, that definitely poses a problem. I work more with individuals who self-direct, so those rates. But specifically speaking towards HAB waiver, one of the things that I like is the fact that we use it kind of in the reverse, in the fact that really, although the waivers are very similar, because of that, if someone needs community living supports or, one of the habilitative services, primarily CLS is the most used, then almost everyone could benefit from the habilitative support waiver. So in our region, that is how we are really having support coordinators to explain it, is as through the person-centered planning process, you certainly want to use every potential resource for funding to build the life for the people that we support. So habilitative support waiver is just one of those methods to bring resources to build and fund the services that the member needs.
Thank you. Yep, and Lucinda, I don't know if many of you know her, but she is from one of our larger regions, Detroit, Wayne. So when I talk about slots, they have a very large number of HSW slots because they have, their region has a lot of Medicaid beneficiaries. So I think they will know very well what that means to get individuals on the habilitation support waiver. So if there's not any more questions, you guys get to see one of the waivers. So what do you guys want to look at? You want me to, and I think you might have to click on one of those links. Do we want to do the HAB waiver, SED waiver, children's? Oh, the most popular HAB. Could you click on the HAB link for me? It's the middle one. Is it? Yeah, the middle one. Sorry, HSW, I apologize. Uh-oh. It's a large application, so I don't know if it takes a while to download. Oh. Oh, I'm so. Fran, which one do you think? The SED or the children's waivers? So do you think even a smaller? So I don't know if the children's waiver, that's a little bit, that's not as lengthy as the HSW. I don't know if that'll be easier to link to. It's a PDF though. This was really like the suspense. I mean, we couldn't wait to show you one of these applications. And just, I have to tell you this, but going through these was really informative for me because I had never actually gone through an entire waiver as my career in mental health until I got to the department. and was just fascinated by everything that is involved and what is detailed in these waivers. If you thought the Medicaid provider manual was like your end-all be-all of reference, there's some competition out there. Oh, look at this. Is there any way you could? Yes. Yeah. So I like who saw the page number. Who was that? Nice. Yes. Pardon me? Yeah, we complete this. So that's why where I said that time frame, there's a lot going on. There's a lot going on. So I don't want you to, I don't want you to get confused by the 8268, because I told you that the number was 7,902. What that means, and Rayanne might be able to explain it better than I can, is it's unduplicated. So we can, if you think about people coming and going off the slots, it's not always 7,902. Within a year, we're going to have, for whatever reason, people withdraw, disenrolling, people enrolling. So we cannot go over that number within that year, so we monitor that. So if there's ever a year where we get very close to that number, we will say to the PIHPs, hold on, no more enrollments. We can't do it anymore because we cannot go over that unduplicated count. So if you also look at community cost, the factor D prime, then there's factor G prime, and gosh, let me see if I remember which one is which. The D prime is that the HAB waiver services? Or HAB waiver is actually the G prime, D prime is state plan services. So those are added together to determine the total cost of community services. It has to be less than, or you can see the total, you can see the total waiver costs. So that is what is the, that is what we anticipate. Oh, I'm trying to remember this, I apologize. I think that is the cost of what we anticipate the waiver will cost us each year. I think there's another chart on here that tells us what the institutional. Well, the institutional would be G times the C, right? Yes, thank you.
So factor C and factor D plus D prime is the waiver cost.
Yes, those are the waiver costs. Yes, thank you. Each waiver has this a little bit different on the front end. So that gives you an idea, and again, you can see our costs go up, and that's just based on like anticipated cost of services going up, those type of things. So when we look at this application, we are in year 4 now. We'll be in year 5 next year. Is there anything else you want to look and see on this application? Will you go to the second page? Yeah, keep going. So this is a letter from our director. This is what I wanted you to see. Remember I gave you that timeline? This is the timeline, and it really, a lot of it falls in line with what I showed you, but this is the timeline from CMS. And then the WY2, 372, that's the 372 report that I was talking about. So those are due every year on 3/31/23. So when we have some of our reporting data requirements, we get it early just so that we can report to CMS in a timely manner. Somebody has a question. I don't think I can walk.
That's okay. I just wondered if you guys benchmark with other states to kind of brainstorm for ideas to streamline or do stuff like that.
I think because we haven't found another state that is similar to us that we've really been able to do that. Maybe in the future with the home and community-based services rule, we might be able to. But we, again, are unique, and so I don't know of any state right now. And I'll be honest with you, I mean, I would love to be able to have time to do that research and see what other states are doing, but I haven't had time to do that. But I think we have a lot of work groups. We have a lot of our community partners that look into what other states are doing and provide us excellent feedback. I know a lot of the work that Laura's doing, she looks at from like person-centered planning and self-determination what other states are doing, and so that feedback is always incredibly beneficial. But every state does things a little bit differently, If we can adopt a way that's working for one state and it'll work within our waivers, we certainly would take that into consideration for sure. Is there anything else you want to see? I mean, I can have them scroll through this kind of quickly. What I'll say about the waiver applications is it's separated into 6 sections, 5 or 6. Appendix A, I think it's Appendix A, B. Yeah, I mean, and then each appendix, if you would scroll just, so the beginning just tells you a little bit about the changes that occurred in the last waiver renewal. And then it talks about our application, so you'll get just general information. And then the first appendix you'll come to really goes over, I think that's our administrative functions. All right, yeah, all right. I sort of feel like we should just end on that. I mean, I don't really... I'm not sure that I can even, right? Oh, ending code. Beginning was 38. Out code is 51. We will come around, if you want to just leave your questions, if you wrote any of your questions out on that 3x5, aka 5x7 note card, we will pick that up, or you're more than welcome to bring it up here. Again, I just want to thank you all for coming. Your feedback was fantastic. Great audience, great feedback, and again, having more sessions, so looking forward to seeing you here. If you do, I forgot to, I think you guys hopefully get a copy of the PowerPoint. I think, okay. At the very last slide has all of our contact information and emails. If you're like me and you thought of a question, but it's tomorrow, feel free to email us. Just all I ask is in the subject line, say waiver renewal feedback. That way we know what it's for and we can get it organized in the right manner. There you go. Thank you. Have a great evening, everybody. Thank you.